lot of information that we have to try to ascertain from our patients during the client interview and getting their full health history. You guys, tomorrow in group 2, we're going to have some fun with that. So I'll let group 1 tell you about all the fun stuff that we will be doing tomorrow, okay? Huh? So, all right. The whole purpose of the health interview is to get subjective information, the patient's perspective of what's going on, okay? We want to make sure that we're having a structured conversation. A lot of times you will, if you're really good at conversating with a patient, they're not going to realize that you've got a structure involved with your conversation with them, okay? But with any procedure, okay, again, driving a manual transmission, right? At first it was, and then you got nice and smooth after a while, right? Same thing with talking with people, okay? So I know quite a few of you out there are very reluctant to get in front of the class and do your presentations and things like that. And I'm not pointing you out, Matilda, it's okay. She's hiding. Oh, I didn't realize I still had this. Sorry, guys. But part of your job is to talk and speak with your patients and clients and make sure, the message that you're sending is what they're receiving, okay? So we want to have an opening stage, a secondary stage, and a closing stage. So an opening stage would be introductions. Hi, I'm Chris. I'm going to be the nurse taking care of you today, okay? Can you tell me your name and date of birth? How do we usually verify that? Their wristband, okay? Now, in long-term care, it's a little bit different, and if you're working in a doctor's office, your patient's not going to have an armband, okay? So what would we use in a doctor's office to verify that information? The chart that we're coming into the room with, okay? That should match, God willing. Otherwise, Mr. Johnson might have, failed to report that he had an obstetric history. Some people got that, not everybody. Great. But in long-term care, for the most part, a patient may not be able to tell you because they might not remember who they are, okay, or what their birthday is. So you have to have in long-term care, in the MAR, the medical record that we typically use, they'll have a picture of the individual, and they're usually supposed to be updated about once a year for those patients, okay? Information gathering stage, what next? What's another question that might fall into there? We don't say chief complaint anymore. We used to say that all the time. What was your chief complaint? Okay, but complaint kind of sounds negative, right? Okay, and we want to have including a thing of wellness as well. Okay, I'm just not as well as I've been feeling lately. I don't know, something's wrong. I just want to get checked out. Okay, it's not necessarily a chief complaint, but it's a reason for seeking care. Okay. Then after we've done all of our information gathering stage, that includes your head to toe assessment, going through, head, ears, eyes, nose, throat, heart, lungs, stomach, abdomen, all that fun stuff. We go to the closing stage, okay? And that could be something as simple as, all right, I'm all done with what I needed to do. Is there anything else I can do for you while I'm here? One big thing that you need to remember when it comes to patient care, especially in the NCLEX hospital, is you cannot tell them, I've got 6 other patients, I need to go. Okay? Because when you're in their presence, they are your priority at that point. Okay? If you have to, if you need to get going because they're wanting to chatterbox, which older people will do because they know you're students and they know you don't have as many patients as the rest of the people they work with. You have to figure out a nice, polite, and professional way to end the conversation. And it doesn't include, okay, yeah, 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 exactly. Just use your call light if you need anything. Perfect, all right. I'll see you later. Perfect. Yeah, okay, sure, bye. Okay. So if it's and we were talking yesterday, and sometimes it's always good to have a backup friend to be like, hey, if I'm not out of here in 5 minutes, come tell me I got a phone call. Because there are some patients that are like that, okay? Types of questions, of course, non-directive, directive, and of course each type is going to have its place that we need. Sometimes we do need to ask yes or no questions, and that's perfectly fine. However, what I want you to get used to doing and practicing, especially when you guys get to the care facilities this semester, is working on your open-ended and therapeutic communication, okay? Really good way to practice it is when you get those solicitors on the phone. Well, why do you feel that I should, purchase this product? You'll throw them off, and usually your call won't be as long because that's not in the script. They're not supposed to ask those questions. Okay. So, of course, our open-ended questions are ones that are going to not be answered by yes or no. Okay. Can you guys think of a couple that you might use with a patient? I want to take some people in the back because they're looking kind of sleepy back there. Now everybody's like, what? I'm busy. Think of an open-ended question. Think of an open-ended question that you could use with a patient. Okay. Okay, yeah, I'm good.
Why do you not want to take this medication?
Because?
Listen, man.
Yes, sir.
Oh, you said you're having pain in your leg. Can you elaborate more on that?
Yeah, it's kind of sharp, and it comes and goes when I'm walking.
When you say sharp and comes and goes, what do you mean by that?
So sharp, like someone's stabbing me. When Okay. Anything else? He was like, I was close to that. Well, in all fairness, you could have a patient, say, cuz, or it could be because I can't afford it. I don't have any insurance. I can't afford $400 for a medication every month.
So would that be? But that's not a yes or no. So,
True, true. I was just giving you a hard time.
Okay.
Yeah. Yes, sir.
Boom. Let's say somebody says that. Then we refer them to like a social worker or something.
That would elicit, it should be a cue for you to, hey, okay, what are some resources available to them that we could put them in touch with so that they can, if they don't have insurance, what could we possibly think of for them to do? GoodRx is one, okay. Medicaid, depending on their age and if they qualify. But then, of course, too, there is access that typically people can apply for depending on their income level, okay, to get state assistance in that respect as far as insurance is concerned. Yes?
At what point do you, obviously you have a conversation with the patient, but do you resource out for like a social worker, have them come talk to them?
So if your patient says, I can't get my prescriptions filled because I can't afford it because I don't have insurance, then you'd be like, okay, well, I'm going to contact the social worker and see if there's any programs that they could help you qualify for.
Let you know that we have resources.
Yep, and at that point they can still refuse.
Still need an order for all that?
No, because that's not something that is involving going like into the patient, so to speak.
So it's okay to just advise them that.
Correct. You can get like a consult like that. Now, if you're going to or your patient needs a consult for a specialty physician, that you have to have an order for, because that's a little different. But therapies and resources like that, you can ask for one. Yeah. Okay. So examples. What kind of outcome would you want to achieve from your plastic surgery? I want to look like Chris Evans. I want to be 6 feet tall. Huh? I would love to be 6 foot tall, but oh well. Genetics suck. All right, describe how you're feeling. When you say it hurts, what do you mean by that? Okay. Close-ended questions. Are you feeling better today? No. Now that you got your first test out of the way, are you feeling better today?
No.
No, but yes. All right. If you find yourself having to like constantly ask a lot of questions and the patient's not elaborating, just kind of try and fix the way you're wording it, especially if you want them to elaborate. Sometimes you just want a yes or no, okay? When it comes to things like pain and things, you definitely want to, when you follow up, you can't just be like, are you still having pain? Okay, more along the lines of, did the pain medication I give you, seem to be working? Okay, that could be a yes or no. And then a follow-up would be, okay, on a scale of 0 to 10, where would you put your pain at now? Plain and simple, okay? Current health history, lots of fun information here. Demographic information is all the nitty-gritty: name, address, contact information, birth date, ethnicity, race. I still fill in, I'll put other, I put human, because I'm one of those people. Just to mess with them. But, emergency contact information. Typically, all of the demographic information that you see here will be found on what's called a face sheet. Every patient will have one in any facility. Even if they're in the ER, they're not fully admitted to the facility, so to speak, at that point. They will have a face sheet that has all of that information on there. Sometimes it'll have the reason for seeking health care or reason for being in the hospital on there as well. It will not have the last two on here, the health history or current health status or history of present illness. Those are going to be found in a section called the history and physical, typically. Okay, doctors, when they do like a full admission for a patient, they have to do an H&P within 24 hours of admission. So that's the full enchilada, and you can find out. They go over the whole health history, every little thing with the patient, current health status, which a lot of this we will be going over tomorrow for group 2. So I hope you'll have plenty of coffee on board for tomorrow. All right. Past health history, childhood illnesses. How many of you guys had your appendix taken out before you were 18?
I think there's still.
Wow. Huh? Oh, only a couple of us that have had our appendix out. Yeah, I know I'm one of them. But I was 24 when I had it taken out. Any surgeries? Had my appendix removed. That counts, right? Okay. Hospitalizations? Sometimes those go hand in hand, right? Surgeries and hospitalizations, but not always. You can get hospitalized, a lot of celebrities get hospitalized with exhaustion, right? Which generally means rehab. But not always. So sometimes you can go in for a surgery and just be there for, 6 hours. You used to have to check in the night before, into the hospital, get a room, all that fun stuff, and then you were in the hospital for at least 24 hours afterwards. But now, they have surgery centers where you go in for an hour and you're done. They recover you, make sure you're able to, pass urine or whatnot, and send you on your merry way. Okay? Huh?
Oh, I was like rhino.
Rhinoplasty? Mm-hmm. Okay. Serious injuries, those typically go with hospitalizations, but again, not always. Any medical problems, these could be chronic. Immunizations, recent travel, or military service. Okay, if anybody's been out of the country in the last 6 months, that's another red flag, because when you go to other countries, they have different things that we don't have here in the United States. Okay, one, believe it or not, I believe hepatitis D. We don't have that here in the United States, but in certain European countries they do. We typically see hepatitis A, hepatitis B, and hepatitis C, but there's still D and there's E even, which I was like blown away. I was like, really? I thought that was just a thing on True Blood, to be honest. So, all right. One of the other things we're going to be doing tomorrow as well is a family history or a family genome, okay? So this is what one looks like. On this one, however, they color in the ones that they're following as far as a disease process that they're trying to track through the family tree. Okay, I have you guys do it a little bit differently for our class, but, and I typically have you do 2 generations back. So your current generation, your parents, and then their parents. Okay, so hopefully, I know yesterday there was a couple of students that were like, I'm going to need a bigger piece of paper because they got big families. So, but yeah, and then I have you guys pick like one family thing from the family history that you get from your partner and figure out like their predispositions and risk factors and things. Yes, sir.
So, I feel like I've always wondered this. Maybe I know the answer, but you know, somebody can get sick. Like, let's say your grandma can get sick and have health issues after she had your mom that were from, you know, her lifestyle. If that happens, you know, that wouldn't technically.
No, correct. So if she
Affect the
smokes or
family line.
something and she's developed lung cancer or emphysema, the cancer part can be genetically linked. Some families are more predisposed to cancer than others. But it was the smoking per se that probably instituted the lung cancer. That's different. We're looking at genetic things like breast cancer. Let's see, what was some of the other ones I had on there? Emotional or mental disorders. God, I'm trying. Not addiction, because that's a lifestyle one. But we're looking at genetic ones that can be traced. So like even receding hair. So I was pointing at me, not at you.
Would we ever? I mean,
Hold
I
on,
wouldn't-
someone had their hand up before you, so it's okay. Go ahead, Savannah.
It's right behind you.
It's okay.
So I thought that addiction, like, so I heard addiction runs in families. So if you're like a child from like two, like alcoholics or something, like you're more
Predisposed? Yeah, it could be.
to like being more inclined to being like addicted to that. Is
Mhm.
that not? Like,
It's more of a, I want to say, nurture versus nature. It was in regards to a mental health condition. Addiction is more under mental health than genetics.
okay, that makes
So, yeah.
Genetic.
Yes. Yes, sir, your
Would-
question.
Would we ever dive into like the effects of Hox genes, or are we just gonna look at? Like, I want to know, like, because we know that Hox genes can affect what's pulled in
Mhm.
the genotypes, but would we ever look at that aspect of the genetics, or would we look more just kind of at like the surface of it, kind of like this person has heart disease, this person has breast cancer?
Kind of more along the lines of just like they have a predisposition to heart problems
Okay.
or Alzheimer's disease, things like
Okay.
that.
Cool, cool. Just
Nothing
sure.
to, if you're working with a genetics firm or a genetics type doctor for genetic therapy or whatnot,
Yeah.
you might go into that more so, but going in as a general practitioner,
Okay,
not so much.
Cool. Just wondering.
yeah, no, you're fine. Okay. Now, psychosocial can inhabit a lot of different things. Okay. As nurses, are we only treating the person's disease process? No, we treat the entire person. Okay. All of these things will influence the way your patient receives or even perceives the care that they are getting. Okay. Also, as well as how well they will align themselves with a plan of care. Okay. Here in the United States, one of the biggest problems we have is not so much compliance, but just disease processes. Okay. Obesity, okay, and type 2 diabetes, heart disease. All of these things are related to diet and, which nobody wants to do, exercise, okay? So you could tell your patient till you're blue in the face, you need to exercise 30 minutes, at least 30 minutes every day, 7 days a week, you know, go for a run, go for a walk, whatever, get your heart rate up. But if they're just like, I don't want to, you know, okay, well, let's think of some type of activity that you enjoy doing, okay? Me, I don't like going for walks here in Arizona because it's too damn hot. I am not a southern person, okay? So what are some things that I could do to get my heart rate up?
Swimming.
Swimming is one. Water aerobics even. Something. right? Anything else? Cycling, because then I get at least the breeze, right? Just not during the summertime, because then it's like driving through a hairdryer.
You can do those little dance classes that they have at like gyms or churches sometimes. Zumba, maybe?
Zumba.
Yeah, there you go.
Mm-hmm.
Boom.
What's the other one? There's Zumba and Pilates would be
Water
another one.
aerobics.
Could be another one. Water. Well, I already said that. Nice try though. Okay, so there's other options people may not be aware of. Okay, so we have to kind of make them aware of it. Well, you could be doing this if that sounds like fun. Try that. You never know. It's always good to try new things. You know, even as students, studying. But you guys are pretty good at that. I don't have to worry about it. All right, review of systems. Now, for those of you, how many of you are planning to go on to become nurse practitioners? Nice. I like it. You are one step below a physician's assistant, though. But you are still required to do a review of systems as well. All right. And you have to do it on your own. We kind of do a really basic one as bedside nurses. It's called the head-to-toe assessment. But it's not so much what the patient's perspective is. We can ask them for clarification, but we tend to just collect the objective side. All right. You go through all the systems: skin, head and neck, breast and lymphatics. Lymphatics is lymph nodes, which is part of which system of the body?
Immune system.
The immune system. Okay. Respiratory, cardiac, and peripheral vascular. Ooh, that's a long one. We know what cardiac is. Heart. But what's the other part of that? Peripheral vascular. Pulses in your extremities. Okay. Gastrointestinal, GU, or genitourinary, which would be? Your genitals and your urinary system. Okay. And then the whole body systems, everything from musculoskeletal, which kind of sounds kind of like a functional assessment, maybe. Okay. Neurologic could actually come into handy with a functional assessment as well, because they don't have the level of understanding. Okay. Hematologic, blood, endocrine system we already talked about. But along endocrine would be what? Hormones, pancreas, pituitary, adrenal, thyroid, all those fun things. Okay. As you progress through, we don't go into too many pathophysiology type topics with those, but as you progress, you will get a lot more. Okay. All right. A functional assessment. You need to remember your ADLs, activities of daily living. And the best way I can kind of help you remember that is the picture up front where it says batted. ADLs pertain to bathing, ambulation, toileting, transfers, eating, and dressing. All those lovely things you have to do every day, and hopefully you're able to do them completely independently. Okay? Sometimes people need help with one or more of these things. And let's see, we're doing hygiene this week. I know at one point we talked about, I think it's module 5 or 6, we talked about mobility, and you guys will learn how to do transfers and all that fun stuff. But this week we're going to be learning about bathing, and I think that's pretty much it, bathing. Some other stuff too. Okay. Oh, and toileting, because you'll have to do perineal care. All right. You'll hear us too talk about, well, we have to do this type of care. Okay. So it's not, I have to go in and wipe my patient when they've stooled themselves or urinated on themselves. I need to go into room 215 to do perineal care. Okay. It's a little bit more discreet than, they got crap all over them, I gotta go clean them up. Okay. Also too, this can have an emotional component to it as well. Everybody here is able to do things on their own, right? Imagine, even at your current age, having to ask somebody else to wipe you because you can't. Your arm, is stuck in a position or something. Okay, you're not able to clean yourself after you've gone to the bathroom and you have to ask somebody to do it for you. Would that be emotionally taxing on you after a while? Especially, how many of you guys like having somebody else do things like that for you? And going, honey, can you go to the grocery store and pick up some bread on your way home or whatnot? That's totally different. Ladies, he's still single. No. But having an assistant with any of these 6 things, people will always be in denial too. You'll have somebody who has a broken bone, a broken hip, and I can get to the bathroom by myself. No. Use your call light. We're here to help you. Okay. Well, I don't want to be an inconvenience. You're not. That's what my job is to help you. Okay. Batted. So the letters of batted spell out bathing, ambulation, toileting, transfers, eating, and dressing. All right. Other parts of the functional assessment that we need to consider too are the internal and external factors. Okay. Internal, self-concept. If somebody doesn't think that they can do it, are they?
Probably not.
Probably not. Okay. That's kind of where the cheerleader aspect of nursing kind of comes in. I'm not saying every patient needs to have a cheerleader. Sometimes we have to be the tough love type of approach. Okay. But encouraging our patients, even if they're able to just, bring that spoon up to get the soup into their mouth on their own. Hey, you're doing good. You'll still be able to do that on your own. Good job. Okay? It might sound petty, it might sound condescending, but for someone who probably has been working on that for a couple of months, that might be like I just crossed the finish line. I can do better. Okay, now what else can I do? Okay? Health literacy. We all know the WebMDs of the world, right? Our job is also yes, that study but it was from 20 years ago, and they've done numerous other studies as a follow-up to that, and this is the current finding, the current level of understanding within the health community type of a thing, okay? There's still people out there that believe, if I've got a UTI, all I have to do is drink some cranberry juice and it goes away, okay? Is there some merit to that? Yes. However, how much sugar is in cranberry juice? Have you guys ever had unsweetened cranberry juice? It is taut. Oh my God, I had never had anything like that before, and I was literally like, I had to water it down to make it tolerable because it was so tart. But even then, you would have to drink gallons of cranberry juice to kind of do that, okay, to have an effect on a UTI. So, stress level, why is stress considered up here? Why would we want to worry about this patient's stress level?
Because stress your body has adverse reactions to stress. It can cause a lot of other problems.
Exactly. If you're constantly under a level of stress, even if you've adapted to it and it's not a big deal to you anymore, okay, your body may not have. If you're constantly releasing adrenal glands and you're constantly in that flight mode, it's going to wreak havoc on other systems within the body. Okay? Activity and exercise. Again, sleep. Okay, older people, they don't need as much sleep as we do. Okay, typically, my grandparents would fall asleep in front of the TV at 8:30. My grandmother would be hanging out of her chair like this. Okay, my grandfather. And then they'd both, get up around 10, go to bed, and then they'd be up at 4 o'clock in the morning. They slept for a full 10 hours. Okay, that's all the sleep that they need. All right. Kids, babies, whole different enchilada because their brain tissue and everything's still forming. All right. Spirituality, this is going to come into context a lot, especially if you deal with Jehovah's Witnesses, because they do not believe in blood transfusions. Okay. And for those of you going to work in with peds, that's another thing too, because the kid can't consent, the parents will not give you consent for blood transfusion at all. Okay. Substance use. So again, tobacco, alcohol, marijuana, Mary Jane, whatever you want to call it.
I was about to sing.
I will say, last dance with no. But when we ask patients about this, we can clearly, it's fairly obvious when they're like, no, not at all, just cigarettes. Teeth rotting out of their face. No, just kidding. But we're not the police, and we have to let them know. I'm not going to call the cops and be like, Mason's smoking dope, okay? It's fairly obvious. No. I need to know as a medical professional, because any medications we give you could have an interaction or a conflict with anything else that you're putting in your body, okay? A lot of times people don't think supplements are, harmful, but certain supplements can have interactions with the medications we prescribe as well, okay? Or it could be causing problems that they're currently taking it thinking, oh, it's just vitamins. Nope. It still has stuff to do with your chemistry within your body, okay? Occupational health, those are things, with what type of work you do, all right? Montre, you work at a gym, right? What kind of occupational hazards could you come in contact with? Slipping, because people aren't wiping up their sweat up off the floor. Okay, or kids drooling, because you work with kids, right?
Yeah, and that just happened to me. My boss
I can read your mind.
I
No.
had two twins,
Uh-huh.
and it was both crying. Like, I would try to sit them down, and they would cry. So I picked them back up, and it was just like snot and tears and crying like it's cool, whatever. You're a little boy, whatever. I had him in my hand, and he like put his hand all on his face.
He's like,
yeah, and he started laughing. And I was like, bro, you did that on purpose. And then his brother, the twin, was just laughing too. Y'all parents need to
but at
hurry
least
up.
they weren't crying.
I know, but I was bad.
But what else, though, too? If you were working with a client and you were showing them how to do, I forget what exercise, a squat with the weighted thing on it, right? With the bar, thank you. Can you tell how often I go to the gym? But you're showing them that and something slips in your back or your footing gives way or whatnot, okay? That would be an occupational hazard, okay? The one, I will say, especially in the hospitals, the one that we typically overlook as far as occupational health, housekeeping, especially in the hospitals. They are exposed to all types of chemicals all day long, cleaning solvents. They come in and out of patients' rooms. And yes, they know about the different transmission-based precautions, but they're still getting exposed to it too, okay? Living environment. I'm sure we've all been in a house and been like, am I on Hoarders? Right? Piles of stuff all over the place. Not necessarily a good thing, okay? Relationships. We've all had a toxic relationship at one point, I'm sure. I'm not looking at you, don't worry. Even family. Might have some toxic relationships with family members. I definitely do, okay? Abuse is another thing, okay? Just because we're dealing with the elderly does not mean that they are immune to abuse, okay? There's elder abuse. There's financial abuse, okay? So it's not just with kids and domestic partners, all right? Come on. All right. I don't know about y'all. I could use a break. I'm sure you can.